Howdy! My name is Kelly Johnson, and I work with the PEER program at the College of Veterinary Medicine and Biomedical Sciences here at Texas A&M University. And we've put together a series of training videos to help you with your educational endeavors. So today, our two veterinarian technicians here at the vet school, Dana Smith and Delisa Ryland, are going to demonstrate the basic emergency procedures that we do here at the vet school.
This is Winn-Dixie. She is going to be our little helper today, and I am going to talk about emergency protocols and first aid. So it's real important when you very first see your patient. You can learn a lot just in the first couple of minutes of looking at a patient. Just looking at their demeanor, how they're breathing, their respiratory rate, and just their overall character, whether they are depressed or very anxious or excited. Whereas Winn-Dixie today, she's a very happy dog. She's very healthy. She has, pink gums that tells us that, everything is circulating properly with her. So when a patient arrives in our ER, what we do is we immediately take blood pressures, Spo2, so that we can make sure that their oxygen saturation is good. We'll do an ECG to make sure that their heart rhythm is good. We take and we auscultate our patient to where we'll take our stethoscope and we'll actually put it on their chest and listen to their heart and their lung sounds. And so I'm going to demonstrate some of these procedures for you and explain them as I go. So first thing I like to do when a patient comes in is I like to actually listen to their heart and lungs. I want to make sure that I've got a good steady heart rate, and I'm going to actually palpate and make sure that what I'm hearing as far as their heart rate, I'm actually feeling that in their vessel as well, okay? I want to make sure that it's consistent. If I'm hearing one thing and feeling something else, then that might alert me to a problem. So I'll take my stethoscope and I want to make sure that I put it in my ears the appropriate way. A lot of times you'll notice on television shows they don't actually put the stethoscope in the right way. So I want to make sure I put it into where I can hear. And I'm going to pull one out so that I can talk at the same time. So I'm going to take my stethoscope and I'm going to put it right up to their left side, which is closest to their heart. And I'm going to listen for the heart rate. And then you can count this heart rate. You can count it by 6 seconds, 10 seconds, or 15 seconds. And then you multiply it. So I'm going to count for 6 seconds. And then I'm going to take and multiply that by 10. And that tells me what their heart rate is in a minute. Next, I'm going to take an Spo2 monitor. And this is going to measure their saturation. And I'm going to take and turn it on. And a little red light's going to come up on here. And that's the side that needs to go. You can take Spo2 on any flesh. You can do it on their lip. You can do it on the inside of their ear. You can do it on her stomach. She's got a lot of, she's real short haired. So on her stomach, you can actually take and do it there as well. So I'm going to do it on her ear because she's got nice and pink in her ear. You will notice it's hard to get an Spo2 on animals that have pigmented gums. If it's real dark inside their mouth, you've got to find an actual pink spot to be able to get that Spo2. And it looks like our Spo2 monitor is failing. Let's see. Can I have your gum? And if their gums are real dry and tacky, they need moisture. And so this machine actually needs moisture to read. So you will not get an accurate reading on this machine if the gums are real tacky and dry. And it normally just takes a few seconds once it actually starts to read. And so you are looking for a reading above 90 for your Spo2. That is their oxygen saturation in their blood. And if you have anything below that, that means that they are slightly oxygen deprived. And it could be just from excitement that causes that, or it could be that their body is they may have some sort of coagulopathy to where they their blood is not pushing through like it should be. So next what we're going to do is we're going to actually do an ECG and we're going to do blood pressures. So when we do these, we want our patient to be as calm as possible. We lay them down in right lateral and we obtain our ECG and our blood pressure. We can do these simultaneously, and that's how I'm going to demonstrate it today. And we do this for, a lot of times we want to get these results as fast as possible, and so that we're, very efficient and we don't miss anything on our patient. And a lot of times, the patient doesn't want to lay in lateral for any length of time, so we want to try and knock everything out as quickly as possible. So I'm going to get Delisa to help me lay Winn-Dixie down in right lateral. And I'll turn the monitor so y'all can actually see it. So this is a blood pressure cuff right here. Very similar to the ones that they use in humans. This one, of course, is a lot smaller. And the way you measure a blood pressure cuff is you're going to put it up to the leg, and you don't want it to be more than 2/3 the circumference of the leg. Okay? It normally is about half the circumference of the leg. We're going to put that on there. We do not want to put it on real tight. We're just laying it on. I use just an extra little piece of tape because sometimes the Velcro is a little bit worn out and we want to make sure that the cuff can inflate. If you put it on too tight, then you restrict the flow of blood to the limb, and that can skew your blood pressure. So you just want to lay that blood pressure cuff on there. That is our very loud Cardell machine. The Cardell is going to measure our blood pressures for us and our ECG. Is it underneath it? There we go. And then I'll start the blood pressure, and the cuff will increase, okay? And then you'll notice over here that it's actually reading, and then it'll pop up and give us a reading, and it'll bring it right down here as well. While that is measuring, we can go ahead and hook up our ECG as well. These little clamps can be a bit uncomfortable. I want to make sure and put this under the edge of the table so that when I hook up the clamps, it's not pulling down on the patient. And I'm just going to find some loose skin and put these on. I try and do it in about the same spot on every leg. And then I'm going to wet these down with just a touch of alcohol so that they make contact with the skin. And you'll notice we've already gotten one blood pressure, okay? And you noticed up here is our ECG. Now the more our patient moves, it can skew our ECG. So we want to make sure our patient is very still for our ECG. And then I can actually print a strip of that. And we'll normally do about a 2-foot strip of ECG for our patient so that we have a lengthy reading that we can actually look at to make sure that there's no underlying heart problems. We normally actually will take 3 blood pressures so that, just taking one blood pressure, it gives us an idea, but we want to take 3 and we want to compare them to make sure that they're all very similar, okay? On our blood pressure, this very first number is going to be your systolic blood pressure. This is your diastolic, and this is your mean arterial pressure right here, this top number, okay? Now that I've gotten all my diagnostics for my patient, then we start to look for any underlying causes of why they may have presented to us, okay? For example, if Winn-Dixie came in today and she was didn't want to eat, okay? She didn't have an appetite. Then we would start to, look for reasons why she doesn't have an appetite. And the first thing we're going to do is we're going to do a complete and full exam, okay? It's a real good thing to go ahead and put gloves on when you go to examine your patient, okay? Because you're actually going to have to, open and look in their mouth. If this is a patient that's, not wanting to eat, maybe she's got, an abscessed tooth or something like that. So we're actually going to take and just grab a hold of her top jaw right here. It's okay, sweetheart. And we're only going to do this if our patient allows it, okay? We don't want to upset our patients, and we don't want to risk anyone getting hurt, us or our patient. But what I would do is I would just take and open up her mouth. Come here, baby. You can let me do it. She's like, good girl. And then I look, okay? And I look to see if there's any problems, okay? We can also take a tongue depressor. We can press down on her tongue, look down in her throat to make sure she doesn't have any type of foreign body down in her throat. We will palpate her abdomen to make sure she's not sore in her abdomen, to rule out any causes of why she may not want to be eating today. If she presents and she has got wounds, okay, the first thing we would do as far as first aid is we would investigate those wounds, and then we would cover them temporarily. We do not want to risk any infection getting into those, so we would immediately cover those wounds to find out how that we want to treat them. We may want to radiograph them if they're over joints, okay, or if they're, on the head or face, to make sure that there's no internal injuries as well. So, each different case is going to be different as far as first aid goes. We do our general diagnostics at first to, check out their heart and, do their ECG and their blood pressure, and then we proceed from there for whatever, first aid procedure they might be needing us to care for.
Well, we hope you enjoyed that video, and on behalf of the entire PEER team, we wish you the best of luck with your educational endeavors. Don't forget to check out our website at peer.tamu.edu for other training videos and free resources. Thanks again, and we hope to see you soon.